Hello, good evening. How are you tonight? I'm Beth Biehl. I'm with Aging Resources Alliance. And we are here tonight to talk a little bit about depression in older adults. So, as we were talking before we started the presentation, one of the things I think that has happened that was discussed is about COVID and how that has led to people not paying attention or not, really having that enthusiasm and wanting to go out and do things again. They've been, quarantined for so long, and becomes depressing. Socialization is a really great, thing for all of us to do. That socialization, whether or not it's with our families, whether or not it's with our children, grandchildren, or just our neighbors, and for so long we weren't able to do that. So we are seeing more depression as we are coming out of COVID in older adults, because older adults really did become, unfortunately, victims of the quarantine and being home. Some of them may not have had family members that were close, and really were in their homes by themselves. Maybe they lived alone. Maybe they had to have groceries delivered and things like that. So as we have seen the end of COVID, and as we have been coming out of it, we definitely have seen in older adults and the people that I work with and see as well, definitely increased depression. So when you look at some statistics about depression in older adults, there are more than 2 million of the 34 million Americans who are 65 and older that suffer from some form of depression. About 58% of those people that are age 65 or older believe it's normal for people as they age to be depressed. And it's really not. I mean, some people have really awesome lifestyles as they mature, and some people feel after they retire they're the best years of their lives. So it really is not a normal part of the aging process. Really, depression is a chemical imbalance in your brain. So when you think about all those types of things, there really are 3 types of depression that we talk about. That's major depression, and that's when you have episodes that last for more than 2 years. It's difficult for you to work. It's difficult for you to sleep. It's difficult for you to concentrate and really enjoy life because you're so worried about other things that are happening around you. And a lot of those thoughts are usually have negative connotations associated with them. The second one is the persistent depressive disorder, and that's sort of the mid-range depression. That will last up to 2 years potentially, and again, really, it's just less severe symptoms of your major depression. So you're thinking about, that ability to work, that ability to sleep, that ability to concentrate. If your mind is somewhere else, obviously it is very difficult to do those things. So it's really thinking about those things and, is it really at that potential where it's lasted a long time, or has it been, a less prolonged amount of time for it? And then finally minor depression. So it may be, one episode of depression, maybe something has happened, maybe you lost a loved one, maybe you know people who unfortunately did pass from COVID, maybe you've lost a pet. Those types of things bring on depression as well. So you have to really look at those types of things that are less severe. And again, it may be just one event that happened that leads to that minor depression. But again, being able to get out, being able to socialize, being around people, as spring is upon us at this point, it's really great for people to be able to get out. And again, at this point, whether that getting out is walking around the block, whether it's coming out and going to lunch with friends or with families, or getting together over the holidays that just recently happened, things like that. So the more people that can socialize, the better their well-being is, and the better they are at really learning how to live and cope sometimes with that depression. So what are some signs of depression? A lot of times people have a very empty mood. They can't really process things. They have a lot of sadness. They have a lot of anxiety. That anxiety, a lot of times makes it very difficult, again, for them to be around people sometimes, to work, as we've mentioned. Social isolation happened as a lot of people have worked from home. And going forward, there will be more people working from home than there were in the past, again. So when you look at those types of things, they are some definite signs of depression. Losing interest in hobbies and activities that you've done for so many years. For older adults, maybe it was a card club, or for men, maybe it was just maybe there were friends in a group that went fishing or something like that. If those things start to stop, then yes, if it was something you looked forward to on a weekly basis or a monthly basis, and the groups are really starting to fall apart, then that might bring on depression as well. Hopelessness, pessimism, guilt. You feel helpless, you feel worthless. Those are all signs and symptoms of somebody who, especially as we get older, have some type of depression. Decreased energy and fatigue when they don't want to leave their house. All they want to do is get up in the morning and go sit in the chair. For some, they may get up in the morning and they may never get dressed for the day. Maybe they continue to stay in the clothing that they went to bed in a house coat and things like that. So when you look at that, those are signs as well. For grown children who are looking after, their older parents, that is a sign, that they will go to the home, and every time they get there, their parents are never up and dressed, and let's say it's a mom, and the mom always got up, and every week she went and had her hair done, and she always was dressed meticulously. And now the daughter goes, and when she gets there, mom is still in her pajamas, her hair's not done, her clothing is not immaculate like it used to be. Having difficulty sleeping, sleeping at all, having nights and days mixed up, The other thing that goes along sometimes with that is that you lack an appetite, you're not hungry, you have weight changes, whether it's that you're depressed and you like to eat when you're depressed, or if you're depressed and you don't eat. So that weight change could go either direction. Restlessness, and unfortunately this also sometimes brings thoughts of suicide for people. So you really have to listen to what people are telling you, especially friends and family, if they are, not themselves and they start talking about different things. You really need to focus in on what they are telling you. And at the end, there are a couple of resources that he did list with some phone numbers that are always good to keep on hand and have handy for you. So as we age, what are the risk factors? So unfortunately, women are about 2 times more prone to getting depression than males are. Chronic conditions. So let's say, unfortunately, your health has declined a little bit, but maybe you have had a major diagnosis, unfortunately. Maybe you've been diagnosed with cancer, or you're diabetic, or you have some type of heart disease. And at this point, you're worried about what the future holds, for that, what the treatments are, how you're going to feel, and things like that. So when we have unfortunate news like that, sometimes that is one of the triggers for depression as well. We mentioned being a poor sleeper. Sometimes you have your days and nights mixed up, okay? Or you eat dinner at 4 o'clock and by 5 o'clock you want to go to bed, okay? And then at like 1 o'clock in the morning you're up and you're wide awake and you think it's time for the day to start. So think about things like that. I mentioned earlier about being lonely, social isolation. That isolation really is a trigger for people. And really, again, what we sometimes see in older adults, that becomes very disturbing for all of us, and really making sure that if it's our loved one, we really can find a way for them to get out, doing the things they, enjoy or used to enjoy. Again, whether or not that's a walk around the block, or working in a garden, or taking care of flowers, or all those things that used to bring them joy that they don't care about anymore. Again, maybe you had a beautiful flower bed or a beautiful garden, and you just decided you don't feel like doing it anymore. It's too much work, and nobody appreciated it, and things like that. So those are things to think about as well. Misuse of alcohol or drugs sometimes. They can trigger some types of depression as well, and stressful life events, as I mentioned. It could be loss of a spouse. It could be divorce. Could be taking care of somebody with a chronic illness. And those are all life-changing things that happen to somebody. The loss of a spouse, especially if you were the caretaker for many, a long amount of time, could be, many months, many years. Your primary focus was on caring for your loved one. If that loved one is no longer around anymore, you've now lost your sense of purpose, because your purpose was being that caregiver and caretaker. So losing those sense, that sense of purpose in, multiple ways, can really be traumatic to some people. What are the treatment options? So yes, of course, there's medications. There's also some therapies. And I'm not going to get into those because I'm not a clinician in the medical sense, but just so you know that, if you feel that you are depressed and feeling symptoms, and feeling just not yourself, we always recommend that you go see your primary care physician. It's always best to explain what you're feeling, what your symptoms are. Keep a list of what the symptoms are. If you're feeling bad at different points of the day, keep a log. Write down, the days and how often it's happening. Because I guess, especially if it starts happening more and more. Maybe you started out and it was maybe, once a week. And now you're starting to be more anxious and it's happening, more frequently. Maybe it's a couple times a week, and then it becomes more like a couple times a day. So you really want to be able to go in with a clear picture for your medical provider and be able to really tell them how you are feeling and how it has exacerbated itself. So they will be able then to talk to you about medications and any other types of therapies that might be available that you would be able to be a part of and participate in. What can you do? If you have a friend, if you have a spouse, if you have a family member, and you know that they have depression, and you just don't know what you can do to help that person out. First of all, be a great listener. Be a friend. Listen. Sometimes listening is the best thing that you can do. Go to their house, take them, a bouquet of flowers. Take them food, take them their favorite cake that you made, maybe there's something that they love that's yours. Make it for them, take it over. What we all really want to do is provide sunshine for somebody, and make them happy. We want to see them smile again. So what can we do to make them smile? Offering that support, being patient, offering them encouragement, be that great listener, If you go to be that listener, and maybe you sit there for 2 hours, you may feel when you leave that you weren't really that effective and you didn't really feel like you helped them out, but you don't really know what the person that you were visiting with feels. If they just had that opportunity to really talk out loud to somebody and just get it off their chest, that may have made them feel that much better. I mentioned going for a walk, getting some fresh air, getting some sunshine. There is nothing better than when we, think about it, come out of winter. A lot of people get depressed in the winter time. It's cold, it's dreary, it gets dark early. So when we start to see spring, we all see people walking. You see them outside walking dogs and, children in strollers. and things like that. The same thing happens as we age and as we get older. You know, you want to be able to go out and enjoy things. And maybe those enjoying things are early in the morning, you know. Maybe you just want to be out peacefully walking around, you know, enjoying the flowers that are blooming at this point and seeing the trees as they're budding. But, you know, just going out and be able to enjoy that fresh air. Or get out and enjoy breakfast, lunch or dinner, you know, with somebody. Whether that's a group of friends, you know, maybe you still have a group that you went to high school with that you still get together with. You know, for me, I know I have groups of friends from, you know, where I grew up locally and also from college that we still get together, whether or not it's by, you know, in-person visits or we Zoom. But we still, and you know, talk on the phone. But we still get together a lot, and, you know, that's really a good support system as well. Taking somebody to a doctor's appointment, you know, sometimes people, that anxiety and they get anxious. You know, if they're going to go see a physician, you know, sometimes people don't want to hear, you know, they're very anxious about what they're going to be told, you know. Sometimes if you go and do that by yourself, it's a really lonely experience, you know. So even offering to drive that person to their appointment, obviously you don't have to go in with them, but being just that support, that you would be able to be there. You know, unfortunately, if they got some news they didn't really want to hear, then they don't have to worry about driving home, and you can be that support person driving them home. And reminding them again that they do have a support system. You know, that support system can be family, friends, neighbors, your church community if you're involved in one. They are all different support systems, and trust me, tap into them. You know, don't feel like you need to bear the burden of everything on your shoulders by yourself. People are out there, you know, to help, you know, and want to help. I think we would be surprised at the amount of people that over the years really do want to be helpers and really do want to be supporters of people. You know, and I think we've seen some of that after, you know, we've been through COVID and we've come out of it, and I think we've seen a lot of really great success stories or stories of people and things that they've done that are good. And so don't ever feel that you're floating, you know, on an island by yourself. Think about those people that are out there that maybe could support you, or maybe you've supported them over the years for, you know, some situation, and really now you feel like you could use that support in return. Sometimes you have to ask them, because people are really sometimes afraid to bring up the subject. So it's really good that just to offer and say that you're there to support them if there's anything that you can do. And maybe offer a couple of these suggestions, you know, that I mentioned as a way to do that as well. Any questions that I can answer?
Well, I just know people who need the help, and, you know, you just don't know what to do sometimes, and, you know, some of these are good, but I'm afraid I'm going to say the wrong thing, or, you know. We have a friend who just found out he has to have his leg cut off because he's got diabetes and it's cancer. I mean, what do you say to somebody like that? You know, I feel bad, I don't, you know, and diabetic, you can't take them food, you know, so it's like, what can I do to make them feel better, you know?
Yeah.
So,
again, you can take them flowers. You know, if they're a reader, you can drop books off, you know, something that will occupy their time. And again, let them know, you know, that you are there as a support for them, and that, you know.
Well, that he knows, but, you know, it's just, you know, I feel lost.
Sure.
You know,
Sure,
know.
Absolutely.
And then it kind of makes me feel depressed, because I think we're all the same age, you know.
Sure. Yeah.
More and more people that I know. One of my groups that I'm with, one of them just died. The other one just lost her husband. He's got diabetes. It's like, how do I keep myself sane? You know?
Sure, absolutely. Again, though, that's your opportunity to be the support for all those people you talked about. Because someday you may need that support on the reverse side. So, you know, I always feel that by giving it, will receive it at some point in time as well.
Mhm.
You know, and hopefully that would come back to you at some point in the future.
Yeah. And, you know, some of these numbers that people give, I mean, you know, I see it's assessment, advocacy, and navigation. I mean, assessment, is this strictly with depression, or is it?
No, no, that's totally different from the depression piece that we're talking about.
Okay.
Yeah, but there are a couple phone numbers on the back of the handout that I gave you tonight. One is National Institute of Mental Health, National Alliance on Mental Health, Suicide Prevention Lifeline is also listed there, and then the Substance Abuse and Mental Health Services Administration are all on the second page of the handout. So, so they're always good numbers to hold on to as well, so that you have them, and you know, unfortunately, if you would ever have to access them, they are there for your use.
Mhm.
Any other questions I can answer for you?
No, that's all I can think of anyway. Like I said, I'm trying to, you know, figure out how to help these people, and
Sure,
I
absolutely.
mean, I know with, you know, when you lose a spouse, you know, you talk to people, you
Sure,
be with them. I
absolutely.
mean, you can cook, you can spend time, but
Yeah, that's
the
the
one
time to
that
offer to
bothers
go
me
to
the
breakfast
most
or
is
something.
this friend with the diabetes who's, you know, gonna have a real life change, and, you know, he's not married, doesn't have family, you know, so it's like, you know, I'm lost. I need somebody to help me along the way to.
Yeah, just be
figure
a listening ear, and, you know,
out. Mhm.
offer to pick up medications at the pharmacy or things like that, or even do grocery shopping if, you know,
Yeah.
any of that needs to be done. So,
Well,
all
I
good
mean,
ways to assist.
Yeah, I have cooked him meals, and I mean, I had diabetic aunt, so I know, you know. But I can't do every day of the week. you know.
Sure, yeah.
I don't think he was really quite taking care of himself the way he should. He's actually in the hospital right now, you know, facing this amputation, and it's like, I know he's depressed, but, you know.
Just be that support.
Yeah.
All right, well, thank you very much for coming this evening. Hopefully some of these tips on depression will be beneficial for you. And as always, if you are feeling depressed, please pick up the phone and call your physician. Get an appointment, share what you're feeling, and come up with a treatment plan that you can agree with your physician to put you on the path to feeling better. So, thanks for coming tonight, really appreciate it. Enjoy the rest of your evening.
Well, I thank you for
You're
coming.
welcome.
Making this effort.
Sure.